If you're getting greater trochanteric pain syndrome, which used to be called trochanteric bursitis, but is now known as all the soft tissues around the outer hip and buttock region being inflamed or aggravated, so that's the gluteal tendons, or iliotibial band resting up and over the hip bone. We know now it's probably more of a chronic tendinopathy or gluteal tendinopathy. Here are some exercises to help with this pain. If you feel you're getting pain in this area and it's particularly aggravated by anything that touches the side, lying on your side, sitting with your legs crossed, excessive prolonged walking, running or standing, and you're getting pain in this area and it's ongoing, then these are the exercises for you. First exercise up is a side plank. We have two variations. We have kneeling or on our feet. So finding yourself on a mat on the floor into a sideline position. Level 1 is with the knees bent, propped up on your elbow, nice and straight through the torso, hips and thighs. From here we're coming up, raising the hips up. By doing that we're working this bottom gluteal muscle and lowering ourselves down. We're coming up and down. Second exercise for GTPS is a lift and lower. This is a Pilates exercise inherently. I have the bottom leg bent for stability, top leg and hip stacked on the bottom hip, shoulder stacked, arm underneath, either resting on a pillow on your hand, or you can come up into a side lean. From there, nice straight leg, nice engaged thigh, flex the foot and just gently rotate the foot towards the ceiling. From there, we're going to lift the leg perfectly up towards the ceiling and slightly behind. So we're really activating this bottom muscle here. And lift and squeeze and lower to touch the floor. Lift and squeeze, lower to touch the floor. What we don't want is the hips rolling back and the leg drifting forward. It must be behind and up. Our third exercise for GTPS is another lying down exercise. It's a single leg shoulder bridge, but with the foot elevated on a step. Lying on your back, feet on a step, taking one leg out of the equation, hovering the leg into tabletop, arms down by your side, pushing down through your heels, squeezing the glutes, and then lowering back down. Driving up, coming back down. Squeeze the glute muscle in the weight-bearing leg. Obviously you can change legs on this one, so squeeze, squeeze, squeeze. Another lovely exercise for GTPS is a side step up. Really activates the glute med and glute minimus on the outside of the hip, and that transference of weight is really important. We have level 1 on a low step, or level 2 on something a bit higher like a bench. So standing next to your step, top foot on the step, we're going to transfer the weight up, squeeze the glute, and then lower back down. Nice and controlled. Stepping up, squeeze the glute, controlling back down. Squeeze, control. The harder level, a little bit higher, stepping up, controlling down, stepping up, controlling down. And finally, we have the banded squats and also crab walks. You can also do a banded shoulder bridge. By activating and working the legs outwards, the knees outwards, we're getting those glutes activating. So a pure standing weight-bearing squat, keeping those knees wide. Squeeze the glutes at the top. Control down. Squeeze at the top. Squeeze. And then of course we can have the variation of the crab walk. We can just literally go side to side, driving the knees outwards. Step apart, step together, step apart, step together. It's a slight sitting position. We're not upright. Slightly sitting in, getting activates the glutes. And of course, a banded shoulder bridge. Pushing those knees out. Squeeze the glutes at the top. And there we have it.